Health Tips, brought to you by St. Joseph's Hospital.
Good morning and welcome to Health Tips, St. Joseph's monthly wellness information program. I'm your host, Denis Sweeney. A AAA rating in the financial world indicates a very good credit risk. However, having a AAA, or better known as an abdominal aortic aneurysm, is a bad health risk because it could burst or rupture. Joining me today to talk about how to treat an abdominal aortic aneurysm are Guthrie Vascular Endovascular surgeons Dr. Lawrence Sampson and Dr. Robert Larson. Welcome to the program. What is an abdominal aortic aneurysm?
Well, an aneurysm is an abnormal dilatation or swelling of a blood vessel. The aorta is the major vessel that runs from the heart through the center of the body, and when this blood vessel becomes weak, usually due to atherosclerosis or hardening of the arteries, the blood pressure can stretch the vessel and balloon it out, which becomes a risk because anything that stretches that much has a risk of rupture.
Now, what are the symptoms associated with an abdominal aortic aneurysm?
Most abdominal aortic aneurysms are discovered incidentally on an ultrasound or CT scan or some other radiologic procedure done for another reason. So most patients have no symptoms when the aneurysm is first discovered. Once it's discovered, it's important that that patient seek medical attention and that a game plan is put in place for how to follow the aneurysm and when to have it fixed.
Leads me to my next question. What are some of the ways this problem can be treated?
Well, the traditional way is with a large operation requiring an incision in the abdomen and replacement of the damaged segment of the artery with a prosthetic graft. Obviously, that's a big operation with the attendant complications that can occur. So for the past 10 years, we've been able to treat these with a minimally invasive endovascular technique through which we can fix the aneurysm using only 2 small incisions in the groins.
Has the endovascular surgery proven to be the best avenue in following to treating this problem?
It is clear that in an anatomically suitable patient, so in a patient in whom the aneurysm is the appropriate shape and size, the endovascular approach has the lowest short-term complication and recovery period compared to the open or traditional approach. In the long run, the approaches are fairly similar in terms of outcomes, but most patients and most surgeons now select the endovascular approach when possible.
Thank you very much, both of you. I'm your host, Denis Sweeney. Please be sure to join us again next month at the same time for our next edition of Health Tips. Until then, have a happy and healthy month.